So we're very excited about our 2019 symposium, which is about biological stress. Stress is always something that is related to pain, whether it's facial or whole body pain. And I think in general as practitioners we think of stress as being a psychological problem, but stress is actually a whole body biological problem. It affects multiple cellular structures and processes and system outputs, and I think that we need to have a symposium that deals with all of those biological consequences, and as well as the neural and psychological aspects of it as well, because I think it is very true that most of our pain patients do suffer from stress, and getting that in order is our first step towards getting them pain-free. This is for anyone who treats pain, so whether that's a physical therapist, a psychologist, a general dentist, a dental specialist. It applies to anyone who treats that, experiences that, or has family members that have that problem. So I think that the previous thought of stress being a psychological problem means that you're very limited in how you approach stress and the treatments that you offer, and also as how you view the symptoms that your patient comes into as applied to stress. So it gives you a very limited telescopic view. So what we're going to do is expand your whole concept of what stress is, how it affects the body, and then what you can do about it, and how it relates to the symptoms that your patient comes in for treatment for, and which of those symptoms are related to stress, and how treating stress can actually help those symptoms. Anyone who treats patients with pain, so I think that it will apply to dentists, it will apply to any other pain-based dental specialties such as endodontics, oral surgery. It'll apply to psychologists, it'll apply to lots of different people. I think that after that event you should change how you are assessing the patient's symptoms, and also how you actually think of who you might refer them to for treatment down the track, and also how you might think that some of the things that you've uncovered during their interview to do with family and psychosocial history, how that might all be related to some of the other physical symptoms that they have. It's relevant because we have our symposium structured so that we will detail the way the stress affects cells, then how it affects their systems, but the whole last day is devoted to ways that you can actually treat those effects. So we have a whole day on actual therapy. So we hope to cover the whole spectrum of from pathology to symptoms to treatment.